So our time is 9:04. So how long shall we continue to wait before we start?
Okay, we can wait for 5 more minutes. We just have 9 people on the line now. Can we wait for 5 more minutes?
Okay, so like say 9:10 we start.
Okay, maybe let's say in the next 3 minutes we can start. We can start.
9:04.
Yes.
So how long shall we continue?
Maybe in 2 minutes time we can start. In 2 minutes time. Yeah.
Okay. Thank you.
Let's start in 2 minutes time with the Russian Approach.
I think we should start.
Dr. Danjuma, can you unmute yourself and commence the meeting, please? Yeah.
Okay. Good evening, everyone. We're all welcome to evening's clinical presentation. Today being 10th of December 2021. This is a clinical meeting that you all been waiting for. This is the dimension that will have an approach that needs this, so that day in, day out, as we encounter some of the challenges out there in our hospitals, in our clinics, in our community pharmacies, we should be able to handle such. And when it requires a referral, we do that as a responsible professionals that we are. So good evening once again. Before we commence anything tonight, we would like to have a word of prayers. I don't know. Let me see. Can Dr. Amin Kamil lead us in prayers, please? Just kindly unmute yourself and then lead us in prayers. Commit this session. Dr. Amin Kamil.
Let us pray. Hello.
Yes, go on.
Hello. Good evening, everybody.
Good evening.
Good evening.
Good evening. As we are starting the meeting, we commit the meeting into your hands, God Almighty. Be with us as we are starting. Assist us in all our deliberations. And let us come out with fruitful decisions at the end of the meeting. And may you please continue to grow our profession. With all the problems we are facing, please try and help us so that we can surmount everything with your assistance. Bijay Fatia. Bismillahirrahmanirrahim. Rabbil alamin. Arrahmanirrahim. Maliki yawmiddin. Iyyaka siratal mustaqim. Siratal ladzina an'amta alaihim ghayril maghdubi alaihim. Amin. Thank you.
Amen.
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 Okay.
So thank you for that wonderful prayers. Our own Dr. Amin Kamil. Before we proceed, we would like to welcome all of us to this session this evening. First of all, we want to recognize all CPAN VIPs present in this meeting tonight. Our able chairman, the chairman of this noble association, Dr. Joseph Madu, welcome to this evening session. All the national ESCOs, all the state coordinators of CPAN, you're all welcome to this evening session. All the fellows of the West African Postgraduate College of Pharmacists in our midst, you're welcome. And all the fellows of Pharmaceutical Society of Nigeria, welcome on board. Our directors, all directors of pharmaceutical services in our midst, and all the head of departments of pharmacy in our midst, we welcome you this evening. Members of the academia, we can't just forget you. The academic community present in our midst, we welcome you, because without your resources, we wouldn't have been able to be exploring or exploiting all this while, because CPAN has been paving ways, have been making waves, not because of any other thing, it's because of the resources that we harness from the academic environment and then marry it with the practice piece. That is why we want to change the face of this profession completely. So you are welcome, Namis. We crop your indulgence that you listen attentively as you also tap from our wealth of experience as we make these presentations. And all participants present, particularly I would like to recognize one of my mentors, Dr. Bala Orume is my mentor. Without him, I wouldn't have been where I am today. He's operating from Abuja end. So welcome to this session. Our own chairman of this of Education Committee, Dr. Solomon Nwafuru. I can't just go ahead without mentioning you. You're welcome. Eugene, Kobe, and co, and all other participants this evening. You're welcome to this session once again. Before we commence, we'd like to introduce our own speaker tonight. Is no other person than a lady with the golden voice. Let me borrow the tune of our able chairman, Dr. Solomon Nwafuru. This lady, if you hear her voice, you know that yes, she means a lot to us. She's a resource material that will not toy with her. Pharmacist Chioma Okonkwo. She is a fellow of the West African Postgraduate College of Pharmacists and a member of CPAC. She works with Alex Ekweme Federal University Teaching Hospital, Abakaliki, Ebonyi State. I understand that she is a secretary of PSM, Ebonyi State. She's also the CPAC coordinator, Ebonyi State. And, if I'm not mistaken, it was an overtime. It's not been captured. Acting chairman also, Ebonyi State. So that's all that it takes to take us through this evening, this present. And she's going to dwell on the topic, rational approach to the management of scorpions, stings, and snakes, the role of a clinical pharmacist. Pharmacist Choma, the court is now open for you. Dissect whatever you have for us tonight. You're welcome.
Thank you very much.
The best of this session. Thank you.
Thank you. Good evening, my senior colleagues, fellows in the house. I appreciate you for joining us in tonight's presentation. Thank you very much for having my humble self on board. We will quickly roll over to the presentation for tonight. Before I proceed, I want us to know that we are all experts and we will be discussing this because I definitely do not know all. And I appreciate the fact that my most senior colleagues are here so that at the end of my little presentation, they can give us the best of what I presented. Thank you once more. I hope I am heard loud and clear.
Yes.
So we'll be looking at a rational approach in the management of scorpion stings and snake bites, the role of the pharmacist. The presenting state is Ebonyi State, SIPAN, and the presenter is my humble self, Pharmacist Chioma Okonkwo. I want to acknowledge my colleagues who made this possible, Pharmacist Nwankwo Linus Enyinaya and Pharmacist Eunice Iboke. They are both staff and pharmacists with Alex Ekweme Federal University Teaching Hospital, Abakaliki. We'll look through the outline, the introduction, the irrational approach in management of scorpion stings and snake bites. Then we'll look at the scorpion and its clinical presentation and treatment and do the same for snakes. And then we'll conclude after giving our case studies and then the references. So a brief introduction. Stings, what can we say they are? They are sharp pricks. They are not bites. They are different from bites. Stings are sharp pricks. You can get them from scorpions, bees, wasps, and jellyfish. But on the other hand, bites, usually with the teeth, just like when we humans bite meat. We don't sting meat, we bite as humans. So other things that bite are animals, example, dogs, cats, rats, snakes, shark, crocodiles. All these have teeth. Now, the effect of a sting or a bite wound depends on the oropharyngeal flora of the stinging or biting animal. What are we saying? That the saliva, whatever is contained in the flora of the mouth, is what determines the effect that biting animal has on anything it is biting. A quick one, when we humans bite meat, remember we have digestive enzymes in our mouth. Digestion starts to take place from the mouth. The same happens with other biting animals. Next slide. Bites results in lacerations, hemorrhage, and bruises. So when you bite, you lacerate. Of course, if it is a living animal, it will bleed. And then it would leave bruises, teeth bruises on the flesh of what was bitten. Now, snake bite is a particular public health problem, of course, in the rural areas, in Africa, sub-Saharan areas, and Asia. But scorpions are the most important venomous animals after snakes. In fact, it's just because scorpions release very little when they sting. Their venom is worse than that of a snake. But because snake bites and has a longer contact with the human it is biting or whatever it is biting, it tends to release higher volume of the venom in its mouth. Next slide. Lack of access to Medicare, unavailability of these antivenoms in the hospital, and sociocultural beliefs has led to the impaired management and increased mortality rates resulting from scorpion stings and snake bites. Now, there are some approaches, next slide, that are irrational, and we're going to quickly look at them. These approaches to management of scorpion and snake bites are not rational because we are yet to get a very documented backing to the use of them. Though they were used before for some of them, but we've phased out of that process now. For example, use of snake charmers and traditional healers, incision at the site of the bite, sucking out the venom from the bite site, use of black stone, tight ligatures or tourniquet, application of herbal mixtures, and drinking of kerosene. In 1 minute, incision at the site of the bite. Most times this is done in the villages, remember? And then when you're putting an incision there, you are introducing a foreign matter to that same wound. So if the wound was not meant to kill you, for example, with the addition of an external, it's not sterile. You're introducing more into the snake and into the body of the person you're incising. Sucking the venom out of the bite site with your mouth, it's risky. Drinking of kerosene, not allowed. These are irrational approaches. Next slide. Others, use of insect and snake repellent chemicals, drinking of coconut water, use of bitter cola, believe that snake bite has no treatment or that snake bites only those who desecrate the land or evil people, use of onion juice in scorpion stings, hitting of one's leg seriously on a tree. I really wonder what the person wants to achieve by hitting the leg seriously on a tree. And then killing of the culprit, whether dogs or snake or whatever it is that beats the person. Now, like I said, these approaches, they were once used, but with the evolvement of technology and everything, and the strides taken in healthcare, we have phased out of this. Then you will see someone say you tie a tourniquet to prevent the blood flow to the brain and then killing the person in the process. What if the snake bites at a place where you can't even tie a tourniquet? What happens? So next slide. This is a picture of a scorpion. I want to say that before I became grown up to this extent, I didn't even know where scorpion stings from. But you can see the picture here. We have the stinger at the tail of the scorpion. So next slide. There has been very few deaths from scorpion stings reported in the USA, Africa, Nigeria. Scorpion stings are not really life-threatening. And then older adults, I mean the older, very older ones and little children have more intense effects. And they are most likely to die from untreated venomous scorpion sting. What are the clinical presentations? Next slide. It is extremely painful when the scorpion stings, extremely painful swelling. You feel numb, tingling, and burning at the site of the sting. When it goes further, there's accelerated heart rate, nausea, vomiting, restlessness, and the rest of them. Then you get higher to breathing difficulties, and then anaphylaxis might occur. Next slide. The scorpion venom. Let's look at it. Why do the scorpions sting? At least they don't know you as a human being, and they don't have any personal reason not to sting. They don't have any personal reason to sting us. So they sting either to capture a prey or for self-defense. So if they feel their privacy is being threatened, their hideout is being threatened, they defend themselves with their sting, by trying to sting you. Now, the venom is a mixture of neurotoxins, and then they contain peptides. These neurotoxins contain peptides, and these peptides block the sodium channel. This will give us an insight to its mechanism of action. How do you treat it? Now, as a pharmacist in the pharmacy, you clean the site of the sting with mild soap and water. Apply cool compress to reduce pain. Elevate the affected limb to the same level as your heart, and then give pain relievers like aspirin. You could give sedative, IV fluid. Next slide. Subcutaneous injection of plain lidocaine. All these are just to reduce the pain and ensure that the person is on fluid intake. Now, there is a scorpion antivenom, and it's used. I hope my
From my side?
No, from the speaker side, yes.
Okay, so please, I want to see the slides again.
Okay.
I can't see them. So, use of scorpion antivenom in severe conditions. And then we're going to be moving. We've ended up our discussion with scorpions. So the ultimate is the use of the venom. Please, I can't see the slides.
Right.
We are moving to snakes now. Yeah, that's where we are. Next slide, please. Sorry, the pictures are not too beautiful, so I want us to look at them. This is a black cobra. Next slide. This python. Next slide. And then these are just different types of snake. Vipers. Okay, now let's move to snake bites. Next slide. Snake bites are classified by the WHO within the group of neglected tropical diseases. When do they occur? Rainy seasons, flood-prone areas, and sometimes hot weather when they come out because they want to get some air. I didn't add, they also stay in dark, cool places, somewhere that gives them just enough air they need. Then you could see them in rural regions, like in the farms, in agricultural settings. Just like scorpion, snake bites to capture prey or for self-defense. Even though in Nigeria, there are some myths behind snake bites, places like Bayelsa, Anambra, Imo, and Yobe, pythons are worshipped. And then they believe that the snake bites only those who desecrate the land or do evil. And so the snake goes after them and catch them and kill them and whatever. Mode of attack, next slide. Some snake attacks by strangulation, like pythons. Some constrict and suffocate their prey to death. Some are by splitting, some stingers, some knockers, and some biters. These are different modes of attacks of different types of snake. Let's look at the snake, briefly at the snake venom. Next, okay, yeah. We have the dry snake bite and the venomous snake bite. So not all snakes have venoms. Remember we said in the beginning that it is dependent on the oropharyngeal flora. What is in the mouth determines what happens to the person bitten. So if a dry snake bites you, of course, nothing happens, just the pain, the swelling, and everything. But when a venomous snake bites, wow, it's dangerous. Types of venom, we have the cytotoxin. Now, some venoms cause swelling and tissue damage. Some disrupt the blood vessels. Some prevent blood clotting, that is allowing you bleed till you die. Some break down the muscles. I want to talk about this one that breaks down the muscle briefly. When the snake bites, just like our digestive system, our digestive juice in our own mouth as humans, it begins digestion. So what that venom does is, okay, I have grabbed this prey. I have beaten this prey. I'll just give it a little time to digest the skin, my venom to digest the skin, and I begin to eat my food. That's in the mind of the snake. Next slide. So that, like we said, this snake venom composes of peptides and enzymes, have a molecular weight of 5 to 10 kDa. And then these are enzymes contained in the venom. Endopeptidase digests the prey. Hemorrhagins and others prevent blood flow. Next slide. Clinical presentation. I'm sorry, I hope I'm not too fast. I want to work with time. Local effects. When the snake bites, what happens? Pain, swelling, bruising, tender enlargement of the regional lymph nodes. And then you could have other systemic effects where you have GIT upset, nausea, vomiting, and diarrhea. Then going further, the longer it stays, the more, it's the effects, which means the venom is really going through the blood vessels. Next slide. Now, like I said before, dry snake bites, just swelling and redness. But venomous snake bites, a lot of symptoms that come with it immediately. Then we're going to look at a picture of the general symptoms of snake bites. You can see that it has a central nervous system effect, has vision where it blurs the vision, systemic where there's fever and severe pain. So this is just a kind of using the human body to tell us at a glance what happens when a snake bites us. Please, the next set of pictures might not be too beautiful for the eyes too. But the next one, identification of snake bites. You can see the hand of, I can't see the slide, okay. You can see the hand of somebody who was bitten by a venomous snake and the person bitten by a non-venomous snake. Then the next picture, it's a local swelling and blistering and bruising following this bite of a pit viper. Next slide. This is tissue necrosis. This is exactly what I was talking about when a snake bites and the venom of the snake contains digestive enzymes. It starts digesting the prey immediately. So next slide. CNS and the central nervous system and the central venous system involvement, these are other symptoms, these are other clinical presentations. Just I'm going ahead to describe the picture we saw earlier, where we saw anxiety, nausea, vomiting, dizziness and blood. These are all symptoms. Difficulty in breathing, difficulty in swallowing, then anaphylactic shock. Next slide. Diagnosis. Wow, this is going to be a difficult one because most snake bite cases come in as emergencies. So we need to be fast. And then back then you say think fast, think with speed. Examine the patient, look for spontaneous hemorrhage. But these days, there are a lot of things that cause hemorrhage. So you need to ask so many questions at so short a time. Then using of the diagnostic kit, and then 20 minutes whole blood clotting tests. These are measures to diagnose. Treatment, next slide. What is your goal when you want to treat? You want to neutralize the venom. You want to limit systemic effect. You want to prevent onset of complications. Now, non-drug measures in the treatment could just be, you really cannot do much if you are not close to the hospital. You assure the patient, immobilize, make sure that whichever part of the body is kept stable. Then remove any jewelry or wristwatches. Then wound debridement or fasciectomy for compartment syndrome. These are things you can do that are not related to drug. Then, next slide, for the drug treatment, you need to identify the snake type. It will go a long way to help in the choice of antivenom. Excuse me. It will go a long way to identify and choose the correct antivenom. Antivenom is the mainstay. You can give artificial respiration, IV fluid. You give normal saline except where patient is bleeding profusely. Hydrocort, adrenaline, and in severe cases, kidney dialysis and anticholinesterase. Next slide, please. Like we said before, antivenom is the mainstay. It is a biological product that typically consists of venom neutralizing antibodies derived from a host animal, such as a horse or a sheep. There are two types of antivenom, the monovalent and the polyvalent. Just as the name implies, monovalent cannot take care of a wide range of bites. Polyvalent can take care of a wide. So in a situation where you do not know the biting snake, polyvalent would be better. But when you know the biting, the snake, the type of snake that beats the person, you can now specifically pick a monovalent that will attack that particular one. Then there is cross-neutralization, which occurs among some snake families. Next slide, please. Now, this is a picture of the traditional antivenom production. We can see the snake. The snake's venom is extracted and injected to the horse. Then you collect the blood of the horse and move down to the IgE. I hope the slides are clear. You purify it. Purify first stage, purify second stage to get the antivenom. And then these are some pictures of antivenom for snakes. Next slide, please. We want to look at a case study on a snake bite. Mr. A is a 50-year-old man. He's a farmer by occupation and was brought to the General Hospital Makurdi on June 20th, 1990. Christian, and then he was bitten by a poisonous snake, and we do not know the snake, but he was bitten while working on his farm. On presentation to the accident and emergency unit of the hospital, he was still bleeding through all his body orifices. You can imagine the distance it took from the farm in a remote area of Makurdi to the town, in a remote area of the state to the town in Makurdi. He was still unconscious, feverish, sluggish in speech. So the venom was already taking effect. And then there was incisions at the site of the bite by the home caregivers. This is to tell you that they had started doing or practicing the irrational approach from home. Next slide. Okay, yeah. When he came there, he was given dextrosaline 1 liter for 8 hours, adrenaline, then IV bolus snake antivenom. I forgot to add that this snake antivenom was monovalent. Then it was required that he slowly repeats the dose after 8 hours, while they check for CNS depression and then give antibiotics and paracetamol. The rationale for the amoxicillin being an antibiotic is okay. For the paracetamol, the pain, yes. Now, the patient was still bleeding on the second day. And the physician wrote that they should look for polyvalent snake antivenom and give 500 mils in 0.9 normal saline over 30 minutes. Next slide, please. On the third day, bleeding was still oozing from the body orifices. Urgent need for polyvalent snake antivenom. It's clear now that the man is staying alive, probably because the monovalent is doing some little work and then the other drugs, but there was need for polyvalent. And all this while, monovalent was still being given. It went up to the 4th day when they finally found polyvalent anti-snake venom and gave. Excuse me. Observation. It was found on the 4th day, and a dose of the polyvalent brand of the antivenom that arrested the bleeding was given. The patient was then placed on hematinics and antibiotics and discharged on the 5th day. Next slide, lessons from this case. Snake bite cases are specific. If the snake was identified or the polyvalent antivenom found, high cost would have been reduced because 23 ampoules of monovalent plus 1 ampoule of polyvalent antivenom, and each of them cost 2,200 as at then. This man would have died if managed at home, definitely. People should be conscious of the surroundings and adopt precautionary measures while at work. Incision might inject bacteria into the victim's body, thus further complicating the condition. Next slide. Pharmaceutical care evaluation. The use of antibiotics, of course, I said, was found appropriate. Dextrosaline was chosen in preference to normal saline to supply glucose to the body while acting as a medium to deliver the antivenom. Now, antivenom is best diluted in normal saline, but this patient was bleeding, and normal saline will increase that bleeding. The pharmacy should at all times make available snake antivenom, though the demand is low. Remember, WHO categorized it as one of the diseases that is less common. Next slide, please. Vaccine challenges. We have a lot of challenges with our vaccines, and this is where I would really appreciate suggestions when we start discussing. We know of the unavailability of vaccines. You can hardly see it in any health. Very few hospitals have vaccines. It is very, very expensive. And those whom the snake bites are the poor ones. They are those in their farms. They are those in the remote villages. So you can see that high cost of vaccines will scare them from the hospital. Okay, accessibility of these vaccines. Are they accessible? And we locked it up in the store. The patient is brought in around 9 p.m. in the night. You cannot access the store at that time. Sometimes where it is kept, because of the cost and the storage, if it's difficult to access by pharmacists who are on call, then there is storage difficulty. There is a particular temperature it should be in. And then short expiry dates of vaccines. All these are challenges that would need to be addressed. Next slide, please. the pharmacists, us. To be able to surmount these challenges, we need to be involved in policy making. We need to be, we don't need to shy away from taking up positions that would give us the enablement to contribute. We need to be involved. I will keep saying this. We need to, if it's only when we are involved as pharmacists. Let's not say we don't want to come out, because when those things happen, it will at the end of the day come back to us. Research. Online, there are so many research on different traditional ways to take care of snake bites, envenomation. There are so many, but none of them, to the best of my knowledge, is fully standardized. So we need to do more in form of research. We need to find out how and make it standard. And when the quantity of the antivenom is increased, accessibility is there, and then availability is there. So we need to be more proactive in research. Then supportive care and first aid. We will not wait for snakes to bite our relations before we learn the basic things to do when we have a snake bite patient. Education and sensitization. This is Christmas season. Most of us will be traveling from one place to the other. Create time, 1 hour, 30 minutes. Educate those around you. When we come together to eat and drink and marry, it is an opportunity to educate and sensitize people. The more we do it, the more we learn more. And then we get views. Because like I said at the beginning of this, don't be surprised. Somebody on this platform, in this clinical presentation, will know much better than I do. But if this topic is not brought to the table to discuss, I will not have the opportunity to learn. The other person who doesn't even know anyone at all will not learn. We are all in the learning process. Let us educate people. Let us sensitize people. It is our duty to do that as pharmacists. And then antivenom availability at all times. I would ask the heads of departments in different hospitals should make it, even if it may, I'm sorry I'm going to say this, but I'm not the head of department and I really don't know how it works. But when you are in that position, the number of lives saved through you is also going to count. So let's make efforts to make sure that at least 2 vials of polyvalent antivenom is in the hospital. I'm saying at least 2 because in most hospitals, you can hardly see any, not even 1 at all. And then lastly, we should learn to follow up on patients. It is very important to follow. It shows them that we care. There are other things we can do as pharmacists. I will expect that during the discussion session. Next slide, please. Conclusion. Assuring and giving first aid is paramount. Transfer the victim of snake bite or scorpion sting to the hospital immediately. Don't attempt to treat, especially when you do not have antivenom. You cannot be doing anything. It is the best practice when it comes to bites and stings conditions, as you may delay and worsen the condition. So with this, next slide, these are the references. And with this, we come to the end of our presentation. Thank you very much all for listening. I would ask for suggestions, for contributions. Like I said, this is not all encompassing. We just picked it to draw awareness to the fact that these are things that should be done. We could bring out more. Thank you very much.
Thank you, Pharmacist Chioma, for that exhaustive and well thought out presentation. Hello, I hope I'm audible enough.
Yes, you are.
Yeah.
Very
so thank
audible.
you for that Wonderful presentation. And it's actually an eye-opening to some of these things. If we consider the topic for today, we will agree with me that particularly those of our colleagues that are into community practice, you must have been seeing people bringing patients. Hello. Sorry, who is? Somebody is distracting us, please. So I will encourage us to kind of digest this and then make some kind of observations, or maybe if we have concerns, we can share it, because this is one area that particularly those of us in the community practice, we must have been seeing people, clients being brought to us with situations like this. And so our actions and inactions may make or mar the whole situation. As she has presented, she took us through the classification, the various from the scorpion stings and the clinical presentation and the treatment. And she took us through the snake bites and classifications and the types of bites, mode of attack, snake, and the types of venom. And then she took us through a case study that was done, even though the case was like about 20 years ago, but then it's still relevant to our practice settings today. So thank you for that wonderful presentation this evening. So the space is now open for all of us to make contributions, and then maybe if there are concerns where we need to shed more light, now through the floor open for us to make contributions. So I can see some hands ready. Hello. Is it from my end?
There's so much noise.
Is it from my end?
Right, that stopped.
Hello. So I can see some hands already.
Hello.
We'll give Dr. Morin. Dr. Morin, Yamabo.
Okay.
After Dr. Morin Yamabo, then Dr. Bala Orumi.
Hello, good evening, House.
Good evening.
Good evening.
Fortunately, this is my first clinical meeting. And this is justice done by Dr. Chioma. And I have really appreciated. I just want to ask for a favor. I hope the slides will be given to us. That's one. Then my concern is about the manufacturers. Now, I work in a student environment, so we always have up to 50 vials of anti-snake serum. The only thing we've discovered through the years we've been buying is that the vial inside the pack will have a different expiring date. And the expiring date on the pack is a different expiring date. Like I have one with me now. It has 2024 expiring date, but the vial inside has 2023 expiring dates, and the distilled water inside has another expiring date entirely. And these have been the problems we've been facing. We are always changing different manufacturers, and we still encounter the same problem. of 3 different expiring dates. The still water having different expiring dates, the vial itself having different expiring date, the packet having different expiring dates. So I don't know, is there anything we could do? These manufacturers, can we get in contact with them? Let them tell us what is happening. Because if you're giving this to a student, now the student is already shouting that we are giving them fake stuff. You are having 3 different expiring dates. That's my own concern. And I don't know how we're going to address this issue, because we are tired of buying different brands. So that's the only my concern. And if there's anybody that can help us address this stuff, I will really appreciate that. That's all I have to say.
Hello.
Hello, Famchoma.
Jot down all the questions.
Mori was making her comments. I had goose pimples all over me.
Why? Okay.
Because, first of all, by the time I see 3 different expiry dates on one medication, I would not use it again. So I understand her very well. It's really scary. I mean, it shows there is lack of confidence. You don't have the trust to use what you are seeing. Wow. In my little knowledge, I feel this question should be best answered by our senior colleagues who are directly involved with the procurement. Because I know at the point of procurement, you look at what you're being given and ask questions. Unfortunately, when I went online to check for manufacturers of vaccines, I found very few. And then the names I got were sounding abstract to me.
I'm telling you.
So I truly do not know where they procure Antivenom from. I must be honest about that. Please, anybody who has a better answer should feel free to educate the house, because I also want to learn. Thank you very much.
Okay. Francis Bala or me?
Okay. Good evening, all. I want to thank Dr. Chioma for her eloquent presentation. I have 2 contributions. The issue of some hospitals or facilities, especially the rural ones that don't have anti-snake venom, is very, very bad. In FCDA, it's a standing order, especially some of our facilities that are in rural areas, you must have anti-snake venom. So for HODs or for hospitals that don't have that, I think they should try. Even the city hospital, Maytama, you go there, you will see anti-snake venom. So please, I urge all head of departments, especially those of pharmacies, to make sure they have anti-snake venom in their facilities. The second concern is in her conclusion, she said that as a pharmacist, once you see a snake bite after doing your first aid, after administering first aid, you should refer immediately. That is very good. But for scorpion bite, and you are very sure, especially some patients will come and they are very sure, some will even kill the scorpion and come. And she make you should give the treatment guideline there very clearly. Plain pain relief, and antibiotics. So should those in community practice, even when they are very sure that the scorpion bite, still refer scorpion bite to hospitals? I think this is something that a very experienced pharmacist should be able to handle. But if you are not sure whether it is snake or scorpion, then you can refer. But if you are very sure, you are really very sure, I think a community pharmacist should be able to handle that. Thank you.
Okay. Thank you for that wonderful contributions. Let me go to the chat box. I think Dr. Dan Oruwasi said, I have not had the opportunity to use anti-snake venom before. So, Dr. Morin, that requested about this, you can private chat him, that you can private chat him or direct your question to him so that you can talk. But I believe Dr. Dan should have said something here so that maybe it may be of benefit to all of us, the platform, to do us all good. As regarding the question of double expiries, I think expiration date, I think majorly is, recently I was waking up around 12 to 1 midnight that this one of our clients had a snake bite, and I was called to make inquiries on how to source for the polyvalent ASV, of which I did, but at the exorbitant rate. The issue there is that the anti-snake venom we are talking about is being left in the hands of charlatans. And
I'm telling you.
the problem is procurement process is haphazardly being done. If not, if actually we do what we call stock status assessment, even before stocking the anti-snake venom, we would have just taken care of this multiple expiration dates that we have featuring in one product. I think it's a problem of a procurement process that is not being followed or to the latter. That is majorly some of the reasons that may lead to that. And it will not be good of us as professionals to have that kind of product being displayed with double expiries. But Dr. Dan said you can private chat him, but I would suggest that you should just make the contribution on the platform so that everybody will take as a take home. I have a question here, Francis Choma. Is anti-snake venom a vaccine? Or anybody
It's a
can
serum.
make that contribution?
Hello. Hello. Hello.
Hello, sir.
Hello. Good evening.
Good evening.
Okay, Dr. Dan. Yes. Good evening,
Yeah.
sir.
Yeah. Good evening.
Good evening, sir.
Yeah. Let me start by thanking and appreciating the presenter. And I believe very strongly that this is an eye-opener for many of us. However, the issue of availability of anti-snake venom, the factors are multidimensional. One, they are not very available because they are not, I think they are one of those orphan drugs. And therefore, people do not readily stock them, particularly in urban areas. But like somebody mentioned that the people in the rural areas have been mandated to keep anti-snake venom. Two, those who stock them tend to hike the price beyond reach. And they will find somebody telling that you have to bring like as much as 20,000-25,000 to buy one dose of anti-snake venom. It becomes pretty difficult for somebody to stock that without having hope of disposing it up as soon as possible. So these are some of the reasons why we have all of this. So when you go to the open market, where most of the time people get to source this anti-snake venom, you are likely to find this shade of one pack carrying one expiry date and another one carrying a second expiry date. As for the expiry dates, the manufacturer of the water may not be the manufacturer of the venom. Because water is distilled water is required to reconstitute it, the manufacturer of this anti-snake venom may just get the distilled water, the double distilled water for injection, and put in his package, and that sends it off. Therefore, the different expiry date on the package, that is totally criminal, absolutely criminal for anybody to relabel or to redate or to revalidate any product. Is absolutely criminal. So it is better for us to look at the date on the bottle, that is on the vial. That should be the date that should be of concern to us. But I do know that people, particularly like you use the word charlatans and so on and so forth,
they are the ones responsible for some of these things. And because at the time you need it, it's usually in an emergency situation. Sometimes it is even better to even use an expired one, because if you don't even have at all, and you have an expired one somewhere, you use it. Maybe you are taking a gamble of 50-50, but in most cases, people's lives are saved. So for us to overcome this issue of availability, we as a country, we need to have a policy where we can hold one manufacturer to it, and then know what quantity we can consume within a period of time. But when it becomes a situation where a few individuals who probably live in the Sahel region, where you have more snake bites, are able to source some of this anti-snake venom and bring them to Nigeria to come and sell at exorbitant prices, even the people in that region may not be able to afford it. So plenty of the stock will also go into expiration. So I'm suggesting, and at any other forum I'm able to make my suggestions, I will still make it. We will want a situation where either government will do that through the instrumentality of Ministry of Health, procure and distribute, or each tertiary institution should just set aside some money in that regard. But if we do a central procurement nationwide, where institutions can come and buy at a reasonably less price, anti-snake venom can be made available everywhere in Nigeria. And then the second one is that it is not a vaccine, it's an immunoglobulin. Because you are talking about fighting the venom directly that has been put inside the body of the individual. While a vaccine is supposed to prevent a reaction that will occur from if you had a snake bite. But we are lucky that most of the snakes, particularly the viperides, are not too venomous, and they are not venomous, except the smaller ones are more venomous than the bigger ones. So we really do not have too much of problems of snake bites and so on and so forth. But where it occurs, it's actually very dangerous, and it is highly mortal. Mortality is high. The chances of mortality is high if it's not treated immediately. But I think we'll bring it on board and other avenues where we have the opportunity. Probably at the next XCG meeting, if we do have one, I'll bring it up again, so that we'll be talking about how do we centrally source for the one whose date on the package will be the same date on the bottle, so that at least that issue of trust and falsification of the product, we can take it out. Because at the end of the day, the pharmacist who will answer for the quality of the product that he has given, whether he bought it from a charlatan or he bought it from wherever, does not count. It is the fact that the pharmacist, who is the person who has the sole license to do this, so he also has to be very careful about how he sources his product. But just like somebody also mentioned, there's the need to do appropriate quantification. Snake bite may not be too much of a problem in the urban areas like it will be in the rural areas. So we must look at that and then see how we can do this distribution in such a manner that every institution should hold at least 5 vials at the minimum. It can even be what you call a gamble, a social gamble. If you sell, fine. If you don't, so be it. But at least it is worth having. It is worth having in stock, so that when people get these snake bites, they will be able to solve the situation. So what I said was that the person who is asking about this issue of confusion in dating, I want the person to put in appropriate question form that he wants. I'll put it on our Comfy platform to find out whether that is the experience that people have across the nation. So if that is the experience that people have, we can now look at it globally and see how we can make a representation to the Director of Food and Drugs to tell him that, look, this is what we notice. Please, can you do something about this? Or we can make a representation on NAFDAC to say, look, this is what we have noticed. Please, can you do something about this? What can we do? Then we now dovetail that into the issue of central procurement, so that once the federal government, through whatever means, is able to procure anti-snake, we can distribute them all over Nigeria so that our people stop dying from snake bites. Thank you very much.
Wow.
So, Thank you for
so much,
that
Dr.
exhaustive.
Make my own comment before my battery runs down. Yes, I want to first start by
Eugene Kobe.
Yes,
Eugene Kobe, please, just 2 minutes.
yes, you made a lot of comments that I wanted to make, but I will just plead with
Please, we have problem with sorry, we can't hear him.
I had
Dr. Ibrahim, can you just mute him so that we can't hear him? Okay.
He's muted.
We have okay. She has dropped her hand. Pharmacist Fola Shade Lawal. She has dropped her hand. Okay. This time we want to call on our chairman. His hand is up. Dr. Joseph Mabu.
All right. Good evening. Good evening. Can you hear me, please?
Good evening, Doctor. Yes, we can hear you.
All right. I want to thank Pharmacist Trauma and Ebonyi State for bringing up this interesting topic. It's a very wonderful one, and every one of us knows that we have added something to our knowledge. And this is an interesting topic, especially in this time of snake bite stocks all over the place. Snakes appearing in toilets and the rest of them. But I'm surprised that we have very few people attending this meeting tonight. In fact, we have just about 60 persons maximum that have attended. Even if the World Health Organization is saying that snake bite is one of the neglected cases, but we as pharmacists, and we know that this is not the kind of topic that we should be very few. I'll be talking on this later, but I have a question for the presenter. Please, am I still audible? Yes,
sir.
Yes, you are audible.
All right. Yes, I have a question about drug interactions. That's between monovalent and polyvalent antivenoms. You said your patient in the case study was on monovalent antivenom, and later polyvalent was added. As a pharmacist, I know that though I'm not working in a general hospital, but sometimes, even if we are doing collaborative care and other things, physicians or some other persons that don't know much may want to know if there will be interactions between polyvalent and monovalent vaccines, or antivenoms, or we just use them. Then I want to thank Dr. Dan Oruwese for all he has said. Actually, he answered a lot of the queries that most people want to know. I know someone was asking if antivenom is the same as vaccine. Of course, no, he answered that. But I also know that someone developed, I think the first world ever vaccine to be developed from natural products was from University of Jos, and they have a treatment center. I learned they have a treatment center there. I also want to find out if there are treatment centers in different hospitals, because when I was online making research on this, I was learning about treatment centers, and some journalists were asking me if these treatment centers are in all hospitals or they are just in some hospitals. So our colleagues in the teaching hospitals can help tell us if the snake treatment centers are usually in every hospital or some or that some don't have it. Then I also want to make a contribution that I know that the Federal Ministry of Health buys anti-snake venoms and sometimes gives it to the different hospitals. So if we are talking about how anti-snake venoms are gotten, I know that you can get from the different hospitals. Sorry that I'm taking your time, but then Hello, can you hear me?
Yes, sir. Yes, sir.
All right, so I'm rounding up. I just want to say that, or I want to find out, or I want to encourage us rather, that the number I said this, that I will say it later. Pharmacists are clinicians and people go to pharmacists, they want to know. So all this few number of persons that we find at our clinical meetings, I think I will still put it on the state coordinators. I think we all need to do more, because the presenter was talking about we getting involved. We getting involved in policy making, we getting involved in different things. If you are a member of a political party and somebody gets beaten by in that party and they know that you're a pharmacist, people will come to you. And maybe you don't even have any knowledge. And then you refer. Yes, we refer, but are we referring to God? We are not referring to God. We must know that the people we are referring to, sometimes they don't even know about these things. So we should know. And as a team, as team players in a hospital, for instance, we don't have any other person to take our responsibility. Even if there is tax sharing or tax shifting, whereby somebody may have to prescribe the anti-snake venom, that doesn't mean that you as a pharmacist should not know almost everything about anti-snake venom or a anti-snake vaccine. These are drugs, and pharmacists are experts. You can't go to any other person to learn. So I want to conclude by thanking Ebony Sipan for this wonderful presentation. God bless us all. Thank you.
Thank you for the wonderful submission. Actually, I asked that question because during the presentation, you mentioned that the ASV is a vaccine. She did mention, so it's an immunotherapeutic product. So it's not a vaccine, but an immunotherapy. You are giving it to treat. That was why I asked, so that we should get it all together. Dr. Ms. Lawal is also adding her voice by saying if the that polyvalent is preferred, so even if the polyvalent or the is expired, you shouldn't throw it away or get a replacement. You said Dr. Dan Uruwase is saying treatment centers are more likely to be in the Sahel region rather than the tropical forest. I know of a treatment center that is in Bombay. They call it Kaltungu. That one strictly, the institution is for treatment of snake bites. So that in that area, you are likely to find all manner of all kinds of anti-snake venom. So those are the things. I think there are some few hands that are up. Okay, none. That is great. So thank you for. I mean, I don't know whether there is still some people that would like to make contributions. If not, to just draw the meeting to a close. Before we go, okay, Dr. Timi. Okay. After Dr. Timi, Dr. Peter.
Good evening, everyone. I just want to thank Pharmacist Chioma. Thank you so much for this. I read from the chat. Pharmacist was trying to tell us that even if it has expired, we can always keep it, because there's been experiences of where they've used the one that has been expired, and it actually saved a life. So But my question now is, I am bothered about the regulatory bodies that normally visit, from time to time, especially for community settings. If you keep such anti-snake venom that has been expired, with the mind that you want to use it to save a life because of the cost, what if the regulatory bodies come in and then they come to check? How do you explain it? I don't know if you can help. Thank you.
Okay, Dr. Alphonsus, you can ask your question. Hello, Dr. Alphonsus, you have the floor. You can ask your question.
Good evening, all.
Yes.
Good evening, sir. Please continue, sir.
Please, can we hear me?
Yes, we can hear you, sir. Loud and clear, sir.
Okay, mine is more of a contribution. I was actually involved in some preliminary processes of the vaccine that was developed in University of Jos. We were actually among the persons that brought case studies or cases of patients that had used the herbal product that became the vaccine. And that is mucuna pruriens. In one of such cases, I had given to some patients that used to have issues, with scorpion bites. And I reported like 2 of such cases to Professor Agui, where the patients were on the tablets. We used to give just 2 seeds of mucuna pruriens to the patients, and they never had issues again. So the one that was developed in University of Jos is what they call COVID Plus. COVID Plus is the one that Professor Agui actually had, and he did some of the some collaboration with a university in Malaysia and somewhere in Italy, and that's the one that was actually launched about a year ago. So it's one vaccine that you can find around him. He's actually looking for collaborators and sponsorship so that we could go into mass scale production of the vaccine. But that's something that is on record as indigenous to Nigeria. What he used to advocate is that patients that have access to such seeds can always stay in areas, can always do well if you can find of their reduced costs, can always take in 2 seeds every 6 months. And if they are bitten by these snakes, they are likely not going to have issues or scorpion, and they are pentavalent or polyvalent, so to speak. So that's just the point I want to bring to the house with respect to what was discovered in Nigeria and University of Jos per se. Thank you.
Okay, thank you. So, Dr. Choma, I don't know whether you can answer that or anybody can give an answer to what Dr. Timipris asked about expiration and the regulation, the regulatory bodies. If they come to your pharmacy and find out that the anti-snake venom you have in stock has expired, don't you think it will, since it's been recommended that even though the ASV expired, you shouldn't just discard it. We could keep it so that it could be used to save lives. Hello. Okay. Hello.
Dr. wants to respond to that. Dr.
Dr. Martin, you have the floor.
Okay. Hello? Can you hear me?
Hello? Can you hear me?
Yes.
Yes, ma, we can.
Please, I'm not set. If I want to be in Dr. Dan's shoes, I'm not thinking he's saying that you should keep that the serum, the anti-serum for over a year because you need to save someone's life. But I think you should please give us the time limit of how long you can keep it, because I don't think you can keep it for over a year just to save someone's life. But anyway, we are pharmacists and we can be smart. We can be smart. When you know that stuff have expired, you should just keep it somewhere very safe, where those people, where the inspectors will never ever find it. But I am not sure you should be able to keep that anti-snake serum for more than a year. I don't think that is what he means. I think he should have a timeline. If he's still around, he can put us through, because I have
Yeah, I'm still around.
after a year. I don't think I can keep an anti-snake venom for over a year. I'm not sure that is what he means. So, Dr. Dan,
Yeah,
please, I think you should put us through for how long you can keep it. But at least you can hide it.
Maureen, well, I think I seem to buy your idea. For those who are in private settings, it's not something ordinarily that you even put on yourself.
Yeah.
Good. And the point I was making is that it's better to even give an expired anti-snake venom than not to give. So we are in the dilemma where the product is not available. And when it is available, it is likely not to be affordable. But most times, particularly for those of us in the southern part of Nigeria, probably except the people in the southeast, but I do know that those of us in the southwest, south, I'm not too sure whether you can count 10 or 20 hospitals who will clearly tell you that they have anti-snake venom on their carriage. However, most of those snake bites too also come at very odd hours.
Yeah.
So you are torn between the, I don't want to use the other word now, between the WT and what have you. Okay? But what I have just said is that if you have it, I did not say keep it. If you do have, okay, as at the time the case is presenting, please go ahead and give. Okay? But you are going to display it on your shelf as anti-snake venom and NAFDAC people come to ask. Don't forget that our rules are Actus, Reus, and Mens Rea and all of that.
Yes.
It is that you have an expired product, and you cannot tell the inspector that, though, I'm keeping it just in case. You know? Well, at a more appropriate time, I'll do some more researches, and then I'll get back to the house on this issue. I will discuss with some people in NAFDAC, and let us see how we get around it. But the bottom line and the best approach to it is to have a situation where we can have some central procurement at reasonable price that people can easily afford. The drug of that nature at 26, 30, 50,000 naira is highly unreasonable. Very, very unreasonable. And the persons who will be affected the most are farmers, who may not even have that kind of money in their vicinity as at that time. And they're likely they won't be peasants. Well, it is not all farmers who are peasants, but it's likely to be peasants, daily paid workers who go to the bush to do one thing or the other. These are the people who are likely to be so affected. And don't forget that before they even bring the person to you, they may have carried that person from one place to the other before you eventually get them in the hospital. So by the time you get them in the hospital, it's already the carrier position. So that is my advice. But I will find time by the grace of God. Maureen will remind me so that I can ask questions and I'll get back to the house. Thank you.
Thank you. Dr. Martin, you said your hand will stay up. We still have only a minute to go, please.
There is something that Dr. Lawal posted on the question asked. Please, can you read the chat box?
Hello?
Please, can you mute everybody? The noise is too much.
Okay, Pharmacist Folashade Lawal is saying, can I respond to that? What you need to do is to mark an expired and mark as expired and store in a corner of the vaccine fridge. Report it as expired. We didn't sell the expired one. We gave it out free to the hospital because it was expired. That her network is bad, if not, she would have responded. So that is just our submission. So that is even the protocol. You just mark as expired. It has to also be passed through the cold chain. It's not to be displayed on the shelf. Thank you. So with that, I think we've come to the end of this discussion tonight. I'd like to thank everybody that participated this evening. It was great. We were able to have up to 70 participants. So we call Pharmacist Joy of Gillard. Pharmacist Joy, please can you disperse us with a word of prayers? She has exited. Dr. Timipri, can you say a word of prayers? Closing prayers, please.
In Jesus' name we pray.
In Jesus' name we pray.
Amen.
Father, we thank you for making it possible for us.
Thank you for making it possible for us.
Thank you so much.
Thank you so much.
Wonderful presentation tonight. Really appreciate protect us and not guide us.
Protect us and not guide us.
Amen. Sorry, Dr. Madu is still raising his hand.
Amen.
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 Dr. Madu, you still want to say something?
No, sorry.
You already said the last prayer.
Sorry, it was a mistake. Can you know it was a mistake?
Okay. So, thank you everyone and good night.